Next, effects of resveratrol and oxyresveratrol on manganese-induced interleukin-8 expression in macrophages, presented by Ms. Nunnaphat Sirijaraswan.
Good afternoon, everyone. My name is Nunnaphat Sirijaraswan. I'm the fourth-year medical student from Faculty of Medicine, Ramatibadi Hospital. Today, I'm going to present about effect of resveratrol and oxyresveratrol on manganese-induced interleukin-8 expression in macrophage cells. So basically, the idea is manganese is a heavy metal that excessive exposures, such as in dry bacteria factories, in pesticide factories, or persons who live in a contaminated air source, could lead to some Parkinson-like syndrome, referred to as manganism. Patients may have some symptoms like slurred speech, bradykinesia, resting tremor, rigidity, or some kind of cognitive declines. And many studies suggest that neuroinflammation is the one thing that plays a role behind it. Since manganese can cause blood-brain barriers, it could cause oxidative stress and could activate an NF-kappa B, which leads to increase in pro-inflammatory cytokine release from microglia cells. And further neuroinflammation would result in neuronal death. So, if we could prevent or decrease the neuroinflammation, such as by decreasing the inflammatory cytokine release from cells, it would be helpful to decrease the effect of manganese that induce some kind of neurodegenerative disease. And the anti-inflammatory substance that we choose in this study is resveratrol and oxyresveratrol. Since resveratrol is a compound derived from grapeseed, and oxyresveratrol is a derivative that has a similar structure as resveratrol, and is derived from Mollusc ovars or Arthropoda, which is a Thai local plant called Maha. And we have a study that resveratrol could decrease interleukin-8 expression in manganese cells. And also, in our lab study, we showed that oxyresveratrol could decrease interleukin-8 expression in astrocytes induced by macrophage cells. Interleukin-8 is one of cytokines that could be induced by manganese. So we hypothesize that resveratrol and oxyresveratrol could decrease the inflammation. In this study, we focus on interleukin-8 expression from macrophage cells. And to achieve our hypothesis, U937 cells is used as a model to study for microglia and macrophage cells. It will be treated with PMA to induce from human-derived monocyte to be a macrophage cells. Then it will be treated with manganese chloride to mimic the condition the patient exposed with manganese. And it also would co-treat with resveratrol or oxyresveratrol to see if this kind of substance could reverse the effect of manganese or not. And then after treatment for 24 hours, it will be done MTT assay and ELISAs. MTT was done to measure cell abilities, and ELISA was done to measure interleukin-8 protein released from cells. And lastly, real-time PCR was done in 3 hours after treatment to measure interleukin-8 gene expression in the cells. And the result would be in the studies by one way ANOVA with done it. And from the result from MTT, we show that a concentration of manganese, resveratrol, and oxyresveratrol that we use is not toxic to cells. So we can be sure that the inflammatory cytokine released from cells is confirmed inflammation that induced by manganese, not from cell death. And after that, the ELISA showed that as you can see from the second pink graph, manganese could increase interleukin-8 related from cells compared to first with the control group. And resveratrol and oxyresveratrol could decrease the effect of manganese that induce interleukin-8 related from cells. However, resveratrol is more potent since oxyresveratrol needs to be 50 micromolars to be effective to increase interleukin-8 that's secreted from cells. And lastly, real-time PCR, you can see the similar trend with ELISAs, since manganese could increase interleukin-8 gene expression in cells as well, and resveratrol and oxyresveratrol could decrease interleukin-8 gene expression in cells. So to conclude, our results show that resveratrol and oxyresveratrol could reduce inflammation for macrophages that induced by manganese, and the effect of resveratrol and oxyresveratrol is more potent than oxyresveratrol. However, when oxyresveratrol reaches its effective concentration, it has similar efficacy with resveratrol. So these two compounds could be developed as an alternative medicine to treat manganese-related host problem or some kind of neurodegenerative disease that induced from manganese. And however, in vivo study needs to be done. And our future plan is to study a signaling pathway that how resveratrol and oxyresveratrol could decrease inflammation by macrophage cells. And that's all from my presentation. Thank you for your attention.
Really stunning. Any questions from our judges?
Thank you for your presentation. So, do you have information about the two of your compounds, so resveratrol, right? Resveratrol and oxyresveratrol. So, can they pass through blood-brain barrier?
Yes, it can pass. It's aromatic substance, so it can pass the blood-brain barrier. It has a study in vivo in mouse too that it could pass the blood-brain barrier. It has a neuroprotective effect.
Okay. Then it should be fine for further study. Thank you.
So you are studying about the effect of the resveratrol on the manganese poisoning, let's say.
Yes.
So in general, if you would like to extrapolate the data in this study to the population, what should be like the general guidance for the general population, that how much should we eat raspberry or mulberry, and for which patient or population that are risk to be toxic by manganese poisoning?
Actually, there is no definite amount that I could suggest how much of grapefruit that should be eaten. However, the patient who is in the risk of manganese toxicity, there is research that the person who is shy, since their blood-brain barrier is not that intact, and also some kind of elderly, since in the elderly they may have some kind of neurodegenerative disease with it as subclinical. So when they expose with manganese, it would induce that neurodegenerative disease to show some symptoms. And also, it is study that women have more risk than men. And in some country that has contaminated environment, there is some study in the water in Bangladesh or in the soil in Canada that report mechanisms. Yes.
Thank you, Ms. Nunnaphat.